Hi, my name is Peter Johnstone. I'm a radiation oncologist at Moffitt Cancer Center, and we're here at our annual meeting, ASTRO, in San Francisco. My guest here is Dr. Niema Razavian, who is one of our head and neck radiation oncologists, and Dr. Razavian is going to tell us some of the new data that came out yesterday in the clinical trial session.
Yeah, so yesterday we had a really exciting clinical trial session here at ASTRO. So a couple things that really stood out to me. So in the world of prostate cancer, a couple of really exciting trials. One of them was looking at a radiopharmaceutical called Platickvo, that's the common name for it, and seeing if we give that before we give SBRT radiation, and if that improves outcomes in patients with metastatic prostate cancer. And so what they found was that the addition of the Platickvo actually extended the chance of, or delayed the chance of recurrence for those patients. So that was one exciting thing. Another one was they reported the initial results of a cooperative group trial through NRG looking at, for men with either intermediate or high-risk prostate cancer, if there's a benefit to treating the whole pelvis versus just the prostate alone. In that trial, they were trying to see if there was a survival benefit. They didn't find that, but what they did find was that using a larger pelvic field did reduce the chance of biochemical failure or a rise in PSA. Another exciting abstract was in the lymphoma world. So there was a study by another cooperative group called ILROG where they looked at, can we lower the dose of radiation that's given after systemic therapy for lymphoma, and they found that a lower dose of radiation was actually safe to do. And then a final thing that I thought was exciting, that it's not actually in the cancer space, but it's in the kind of benign disease space, is using radiation for something like osteoarthritis. So there's a study out of Korea where they looked at using low-dose radiation for the treatment of knee osteoarthritis, and they found that this low-dose radiation compared to what they call a sham radiation actually improved people's pain outcomes.
So it looks to me like people here at ASTRO are looking for new indications?
Yep.
Even if it means we're going to be doing radiation with, say, new systemic agents or in fields that we hadn't previously thought of using radiation for.
Exactly, and that's been the major theme of this meeting, is really kind of expanding or looking into other ways radiation can be involved in other diseases that are not just cancer.